Hello guys, you're welcome to Alicia's Medhope. We'll be doing histopathology today and we'll be talking about hyperemia and congestion. Hyperemia and congestion both stem from increased blood volumes within tissues. Sorry about this is supposed to be within tissues. Now, accumulation of blood in tissues usually is the accumulation of blood in tissues, usually within blood vessels. However, they have different mechanism and consequences. Now, erythema is a term used to describe the increase in blood flow to a particular area, consequently making that area to become reddish and warm. So when there's increased blood flow to an area, the area becomes reddish and warm. Now, example of conditions that can cause hyperemia, erythema include exercise and inflammation. Now, congestion, cyanosis or hypoxia, there's increase in blood flow to an area, but this blood is deoxygenated, right? So there's blood flow to an area, but the drainage system is poor. There's this decreased outflow. So the drainage system, that's the venous area, is is not functional as it used to. So example of condition that can cause this is local. It could be local obstruction, congestive heart failure, and hyperemia. Hyperemia is an active process in which arterial dilatation leads to increased blood flow or accumulation of arterial blood in tissue. Hyperemia, I'll take it again. Hyperemia is an active process in which arteriolar dila- dilation leads to increased blood flow or accumulation of arterial blood in tissue. Affected tissue becomes red, erythema, due to the delivery of increased oxygenated blood. So you could see this individual. It's an active process. So hyperemia is actually occurring. That's why the face is looking reddish, right? So there's increased blood flow. There's decrease. There's increase in blood flow, right? There's no obstruction. There's no active obstruction. So consequently, the area becomes reddish and usually warm to touch. Now, congestion, on the other hand, is a passive process resulting from reduced drainage or outflow of venous blood from the tissue. It can be systemic or localized. Affected tissue have dusky blue-red color cyanosis due to stasis and accumulation of deoxygenated blood. Stasis simply means settling, right? The settling of blood in this context, the settling of blood. Cyanosis refers to deoxygenated blood. That's the decrease in oxygen supply to a particular tissue. The tissue becomes cyanotic, or the individual becomes cyanotic when there's decrease in oxygen supply, around the body. Now, chronic passive congestion is associated with hypoxia. Congestion leads to edema because there's accumulation of blood, right, within the tissue. Remember our last video, hemosiderin laden macrophages. Yes. Now, so this is a patient who is a cyanotic patient. You could see the the digits are bluish red, right? It's an indication of cyanosis. That there's decrease in oxygen supply, decrease in oxygenated blood, right? If you look at the tongue, it's bluish reddish in color, indicating decrease in the supply of oxygenated blood to these tissues. So now there's a clear difference between hyperemia and congestion. So this is more like trying to map out a table to differentiate the two. Now, hyperemia is an active process, while congestion is a passive process. It involves hyperemia involves arteriolar dilatation, while congestion involves the venous end, venular constriction or obstruction. Hyperemia is characterized by increase in arterial blood flow. On the other hand, congestion, there is decrease or reduced venous blood outflow, right? Yeah. So hyperemia, there's accumulation of oxygenated blood. On the other hand, congestion, there's accumulation or stasis of the oxygenated blood. Hyperemia, affected tissue turns red, erythema. That's where the term erythema came from. On the other hand, congestion, affected tissue turns dusky reddish blue, cyanosis. So thank you so much for listening. Please, if you haven't subscribed to this channel, kindly do so so that you and hit, of course, hit the notification bell so you get updated on um, new videos that will be posted. Thank you.